Pit and fissure sealants. Pit and fissure sealants are material which are introduced in the occlusal pits and fissures of caries through teeth, thus forming a micromechanically bonded protective layer, cutting access of caries producing bacteria from their source of nutrients. The morphology of pits and fissures given by Nagano in 1960, they are basically V, U, I, K, IK, and inverted Y type of fissures. Among these, V and U are actually self-cleansable in nature. I, IK, and inverted Y are not self-cleansable, and therefore these type of pits and fissures are more prone for caries. Now, how pit and fissure develop caries? The toothbrush bristles are actually not accessible to the areas of pits and fissures. As a result of this, debris will accumulate over the outer surface of pits and fissures, and later an organic plaque will be formed over the top layer of pit and fissure. This organic plaque will contain microorganisms, which in turn will travel from among the outer surface through the enamel into the inner dentine, and as a result, the enamel will get demineralized. Later, the demineralized enamel will develop into a cavity, leading to formation of caries. Now, coming to the classification of pits and fissures given by Gordon in 1990, based on the polymerization methods, can be classified as self-activation produced by mixing two components. Then light activation, which consists of first generation, which is cured by UV light, second generation cured by self-curing, third generation by visible light, and fourth generation, which is fluoride releasing in nature. And based on the resin system, classified into BSDMA and European acrylate. Based on the fillers, it's classified into unfilled and filled. Based on color, it's classified into tinted and clear. Clear has got a better flow when compared to tinted. So what are the basic requirements of a pit and fissure sealant material? Given by Brown in 1978, should have a viscosity allowing penetration in the deep, narrow, and fixed fissures, even in the maxillary teeth. It should have adequate working time. There should be a rapid cure. It should have a good flow, and it should have good and prolonged adhesion. Should be low absorption and solubility, should cause minimum irritation to tissues, should be resistant to wear, and it should have kerastatic action. The composition consists of a resin, basically BSDMA, dilute TECDMA, opaque titanium dioxide, yttrium fluoride, and polymerization activation chemicals. The indications, it is indicated in case of moderate or high risk of developing dental caries, in which there is incipient caries lesions limited to the enamelar pits and fissures, deep, narrow pits and fissures, presently erupted to sound proximal tooth surface, patient receiving appropriate systemic or topical fluoride therapy and still caries active, then a community-based sealant programs, medical history with factors associated with increased caries incidence or xerostomach medications. Contraindications in case of wide and self-cleansable pits and fissures. Teeth remains caries-free for 4 or more than 4 years. Caries proximal to surface is present. Then general caries activity in which there are many proximal lesions and caries pits and fissures. Now, advantages, it is a non-invasive technique. Sealing a pit and fissure will prevent tooth decay. Fluoride release from the fluoridated sealants can confer projection to the adjoining areas. Sealant can be used as the community level for prevention of caries. Disadvantages is a caries susceptibility of the enamel, economic feasibility, then inadvertent placement over the caries site and detection of loose sealant and technique sensitivity. So coming to the basic steps in pit and fissure sealant application, the first step is cleaning, next is isolation, then acid etching, washing and drying the etched enamel surface, application of sealant to the tooth surface, then curing the sealant, exploring the sealed tooth surface, evaluate the occlusion of sealed tooth surface, periodic reevaluation and reapplication of the sealant if necessary. First step is isolation and diagnosis. So proper isolation is very, very essential before placing pit and fissure sealants. In case of a moist field, there are more chances for dislodging the material. So proper isolation can be achieved by using a rabadam. And after placing the rabadam in proper position, you can go for the next step, which is cleaning. So the area in which the pit and fissure sealant application is to be done is to be cleaned thoroughly. After that, the next step is acid etching. So acid etching can be done by using 37% phosphoric acid. And after etching, the etched surface will appear white and frosted. Then after etching, the etching should be washed away with water. And after rinsing the etchant, then proper drying of the area should be carried out. And after properly drying the area, next step is placement of sealant. And in the case of etching, earlier there was a concept that primary teeth requires more amount of etching time. because it has got more amount of eprismatic enamel. But the recent studies have shown that eprismatic enamel is only on the cusp tip of the primary teeth. So recently, the concept is that etching time is same for both primary as well as permanent teeth. That is about 20 to 30 seconds of etching time is enough for primary as well as permanent teeth. Then after etching, you can go for application of sealant material to the tooth surface. Then next step is curing the sealant. After curing, you have to check the sealed surface with an explorer, and you have to see whether there is any catch on the sealed tooth surface. If it is without any catch, you can assume that the material is properly placed. So these are the steps in sealant placement. This is the clinical picture of Dept Fissure Sealant before application and after application. Now you have to recall the patient every 6 monthly, and you have to check the occlusion, and you have to see that any material has been lost. If there is any loss of material, you have to repair it. And if the material is completely lost, you have to reapply the material. Now coming to some of the commercially available Dept Fissure sealants. First is Tetric Flow, which is manufactured by Vivadent Company. Then HelioSeal F, which is a fluoride releasing Dept Fissure sealant manufactured by our Ivoclar Vivadent. Then we have Enamel Lock, which is manufactured by Premier Dental Products. Now coming to some of the special Dept Fissure sealants. Wet-bond Dept Fissure sealant. It can be used in a moist field, and it was the first Dept Fissure sealant which can be applied in the moist field. It has got a unique resin acid integrating network, and it bonds chemically as well as micromechanically the moist tooth surface. Next is illuminating Dept Fissure sealant. It uses a UV pen light for curing. The commercially available one is Seal and Glow. It has got a blue or white color as fluorescence. So visual verification of the sealant margins can be done using this illuminating Dept Fissure sealant easily. Next, Dept Fissure sealants with ACP, that is amorphous calcium phosphate. It is resilient as well as flexible. It has got a chemical and thermal barrier that protects the tooth surface. It is actually a smart material. That means it releases calcium and phosphorus slowly when the pH drops. Now this is Embrace Wet-bond Dept Fissure sealant, which is a recently introduced one, which can be used in case of a moist field. So these are some examples of fluoride releasing Dept Fissure sealants. Embrace Wet-bond is a fluoride releasing one as well, and also direct seal. All these are fluoride releasing Dept Fissure sealants. So Dept Fissure sealant application is basically a preventive procedure. In cases where you have extremely caries prone pits and fissures, you can go for Dept Fissure sealant application. And also in cases where patients who are highly caries active or with any systemic or medical conditions in which there are more caries formed can also be used for Dept Fissure sealant application. The case in which Dept Fissure sealant is contraindicated is where you have a lot of proximal lesion, or in a tooth in which there is a proximal lesion, you can go for Dept Fissure sealant application. So Dept Fissure sealant gives protection to the occlusal surface, but the case should be selected very carefully for the sealant application. Otherwise, you will end up in a case where there is a proximal caries, but you have gone for Dept Fissure sealant application, which will cause a misdiagnosis as well as a misdiagnosis as well as a wrong treatment for the patient. So the case selection for the Dept Fissure sealant should be done with a very careful effort, and the case should be properly selected before sealant application so that the right person should be selected for the sealant application and the right material for application should be done. So Dept Fissure sealants, if applied properly, gives protection to the occlusal surface, and also they will prevent much costlier treatments in future.